again, everyone. Welcome to Fayette Regional Health Talk. I am Tammy Dowd.
And I'm Doug Fischesser. Thank you for joining us. Health Talk is your source for health and wellness topics in the Whitewater Valley.
That's right, Doug. And Fayette Regional Health Talk provides up-to-date health news and events that are important to Connersville, Fayette County, and the entire Whitewater Valley. Leading this edition of Health Talk News is a reminder that Fayette Regional team includes many specialists vital to the care and well-being of our community in fields such as cancer, cardiology, pulmonology, diabetes care, urology, podiatry, and many others.
With dedicated doctors and nurse practitioners who are committed to bringing excellent health care to Fayette County and the surrounding area, Fayette Regional is your community hospital. The Fayette Regional Cancer Care Center brings the expertise of Midwest's leading cancer networks right here to Connersville with Dr. Robert Mangus of the American Health Network and Dr. John Marvel of the Cancer Care Group.
Their involvement in ongoing clinical research assures that patients receive the most advanced treatments and therapies available right here in our community without the long drive.
Fayette Regional is also proud to offer excellent heart care with their partnership with the St. Vincent's Heart Care Center. St. Vincent's is rated as Indiana's #1 cardiology group, and they are here for you with 7 of the Indiana's best physicians and nurse practitioners on staff. It's the power of 2 hospitals for your heart's health, providing unmatched quality and expertise in cardiology.
With the goal of increasing patient functionality, Fayette Regional offers board-certified pain management and Danielle Turnek of the Pain Management Group. Dr. Turnek created a tailored care plan specific to each diagnosis along with custom service agreement to help ensure compliance with the care plan. The Fayette Regional Pain Management Center is accepting new patients. Call today.
Can't afford health insurance? Choosing a healthcare provider, determining monthly premiums, and understanding health insurance plans may be difficult for individuals and families who have never had health insurance. Fayette Regional can help. The Healthy Indiana Plan, HIP 2.0, has been expanded, and now many more Hoosiers qualify. There are inexpensive plans that include medical, dental, and vision care. Fayette Regional has the resources and staff that can help you sign up. Call 765-827-8998 or visit fayetteregional.org, HIP, for more info.
As part of Fayette Regional's continuing efforts in community outreach, we are providing monthly screenings and activities as well as participating or hosting several events in and around Fayette County. The first Wednesday of the month, Fayette Regional will be at Fountain Place Apartments in Connersville to provide education and activities beginning at 2.
To end the first week of each month, Fayette Regional Care Pavilion and Jerry Sykes Services host a Caregivers Relaxation Luncheon on the first Friday from 11 to 1 p.m.
We are pleased to offer this Caregivers Relaxation Luncheon as a time of respite for caregivers to refresh mind, body, and spirit and learn ways of taking care of themselves. Call 765-827-8022 for more information or to make your reservation.
The second Tuesday of each month is a busy one for Fayette Regional. Southview Courts in Liberty, Indiana hosts Fayette Regional. Blood pressure and blood sugar screenings are provided along with education and activities.
Fayette Regional is also at the Franklin County Senior Center at 9 a.m. the second Tuesday of every month. Again, providing education, activities, and health screenings. Continuing on the second Tuesday of each month, Fayette Regional offers a free lunch to area seniors at the Fayette County Senior Center. This monthly event is always well attended and free health screenings are offered. Our presentation begins at 11 and lunch will be served at noon. If you wish to attend, please make your reservation by calling the Fayette County Senior Center.
Fayette Regional and staff and community alike raise their sleeves throughout the year to give the gift of life. Last year, over 60 units of blood were donated, helping supply over 60 hospitals in Indiana. Please join us by supporting these blood drives. Our next blood drive is Tuesday, December 8th from noon to 4 p.m. Go to fayetteregional.org for a full listing of blood drive dates and tune in for TV3's listing of local events to find other special events that Fayette Regional is hosting in your area each month. We look forward to seeing you.
Finally, As a reminder that Fayette Regional Health System is here for you during this cold and flu season with extended hours and 3 family-friendly locations for your primary care and immediate care needs. The Fayette Regional Primary Care Center has a full staff of care providers with Dr. Ryan Minnick and Dr. Jessica Duyard, along with experienced nurse practitioners. They take care of all of your immediate care needs 7 days a week, and walk-ins are always welcome Monday through Friday, even on weekends for adults, seniors, and children too.
Fayette Regional Physician Center is conveniently located just 2 blocks east of Fayette Regional Hospital. Dr. Gary Metcalf joins nurse practitioner Janice Horan, and they are accepting new patients. They can provide excellent primary care for your entire family.
Fayette Regional Healthplex in Brookville would also like to welcome families for their primary care. Dr. Damian McKnight and nurse practitioner Christy Flum are available at our Brookville location. Together with urgent care specialist Dr. Ken Perrin, Fayette Regional Healthplex is able to provide the care you need whether you have an appointment or just need to walk in.
When we return, our guests will be in studio to help us give us a few more details about how Fayette Regional can help you during this cold and flu season. We'll be right back.
Walk-ins are welcome at Fayette Regional Primary Care Center. Open 7 days a week for when children, adults, and seniors need to see a doctor. Open 8 a.m. to 6 p.m. Monday through Friday and 9 to 3 on weekends. With both doctors and nurse practitioners on staff. No appointment necessary. Located in Connorsville at 2025 Virginia Avenue, just 1 block north of Fayette Regional Hospital. The Fayette Regional Primary Care Center.
Fayette Regional is proud to offer the area's best heart care through their partnership with the St. Vincent's Heart Care Center. St. Vincent's is rated as Indiana's #1 cardiology group, and they are here for you in Connorsville. It's the power of 2 hospitals for your heart's health, providing quality you will not find at other area hospitals. For your health, remember great care is right here. Fayette Regional.
Welcome back. Joining us now is Carol Yeager from Fayette Regional Health System. Thanks for joining us today, Carol.
Glad to be here, Tammy.
Carol is the Infection Prevention Director for the Fayette Regional Health System. She is also the health coordinator for the team members at Fayette Regional. We appreciate you joining us today. Tell us a little bit about yourself, Carol.
Well, I've worked at Fayette Regional over 20 years, and I live in nearby Rush County, and I really enjoy my work there. Helping people be healthy is a great job to have.
I know you chased me around for that last flu shot every year.
Yes,
so I know
you're a moving target.
You're still going to tie me down and give it to me, I know.
Let's get right to this. This is your busy time of year.
Yes, it is.
Has flu season officially begun?
Yes, it has. You can get the flu anytime during the year, but obviously in the summer we don't see very many cases of the flu. We usually consider flu season October through March, and the peak months would be December, January, and February.
Okay, so then when should you become vaccinated? When should you come to see you?
Yes, vaccine usually becomes available in August, and if you want to be early, you can get your shot as early as August when that season's vaccine becomes available. I like to recommend people get their shot before those peak months of December, January, and February to get the most mileage out of your vaccine. You want to be protected in those months where we have the most cases of the flu. So you would probably want to be vaccinated in October or November. So if you haven't already gotten your flu shot, now would be a great time to do that.
Talk a little bit about the different vaccine options that are available.
Yes, most of us are just familiar with what we call a flu shot, which is the injectable flu vaccine, and that's the one that we see most commonly. There's also a nasal, but there are some limitations with that. You have to be under 50 years of age. You don't want to have any chronic conditions, anything like asthma, and it's for non-pregnant individuals as well. So there's some limitations with the nasal vaccine, but it's a good option if you meet the criteria. There's also an intradermal. That one I do not have any personal experience with. So usually when we're talking about the flu, we're talking about the flu vaccine that's injected.
Okay.
I see. Where can I get vaccinated?
Lots of places. Obviously, your primary care provider would be maybe your best choice. That all the doctors have flu vaccine. I know at Fayette Regional they all have flu vaccine at their offices, so that would be an option. Most pharmacies have flu vaccine. Some places of work offer flu clinics, so you can get a flu vaccine right at your place of work. And the local health department also has flu vaccine.
I see. Is it very costly?
No, usually it's always covered by your health insurance. It's considered something that is part of wellness and a preventative health initiative, so usually it's covered by insurance. I know the health department, when they went to the senior center, they only charged $20 for those people that did not have insurance. So even if you would have to get a shot, it would be less costly than being sick for a week with the flu.
I see.
Well, we know the what and the where, but can you tell us the why? Why should I become vaccinated? And then is there anyone that should not be vaccinated for the flu?
There are a few people that should not be vaccinated. If you are allergic to any component in the flu vaccine, obviously you would not want to be vaccinated because you would have a serious reaction. So some of the components in the vaccine for flu are egg protein. So if you're allergic to eggs, you're not supposed to be vaccinated. And then if you've had a serious reaction to a flu shot in the past or some other vaccines, you're probably sensitive to some component that they use in the manufacturing of vaccines. So you would not want to get another vaccine. But that's very few people, so you probably do want to get a vaccine. And one of the reasons you want to get a vaccine, in particular for the age group over 65, is we always have a lot of flu deaths. Indiana has already had one death from the flu this year, and last year we had over 140 deaths. So the flu isn't something that is just a minor inconvenience. It can be very serious. So if you can prevent serious illness with a simple vaccine, it's the smart thing to do.
Okay. And are there reactions that we should be looking for? Negative reactions, I guess, to the flu shot that we need to be concerned about.
Yeah. There's just very minor reactions. When you have an injection, just like when children get a measles vaccine or something, you're going to have a little pain and maybe redness at the injection site, and that's the most common reaction. And you would expect that because you are being injected with the vaccine. Some people experience a headache, and those would be the two most common reactions. And of course, you can take a fever reducer or pain reliever to deal with that.
Okay.
Here's a question I think that's on everybody's mind. Give us a little idea of what the difference is, the common cold and the flu.
Well, there's a lot of similarities with both. It's a respiratory problem. You might have a fever, you're going to have some congestion, some coughing. But the two things that I think are the major difference is with the flu, you have a much higher fever. Usually a cold is a low-grade fever, and with a flu, it's 100 degrees or more. And then I think the big difference is with the flu, you are absolutely exhausted and you're very fatigued. Most of us with a common cold, we've all had a common cold, we get up, we go through our daily routine, and we can function. If you have the flu, you are so exhausted and achy that you don't want to even get out of bed. You're not going to want to go out of the house. So you're not able to function with the flu.
Talk a little bit too, Carol, about the way the flu is spread and some recommendations on how to prevent it from spreading.
Yes, the flu is spread by contact. So it's all those communal surfaces that we touch. And there was a study I read recently that people on the average touch about 3 different surfaces like that every hour. And those would be things like doorknobs and phones and just common surfaces. And then the problem is then we go and we touch our eyes and our mouth and our nose, and we're inoculating ourselves with all these germs. So it's very important to wash your hands, and you can do that at a sink with soap and water, or you can use the new hand sanitizers. They make ones in small sizes so you can carry it with you at all the time. So make sure that you keep your hands clean. If you're ill, stay home so you aren't spreading it to other people. If there are people that are ill around you, try to avoid them, and then get your flu shot.
Great.
Can you kind of give us an overview of what to expect this flu season?
Well, unfortunately, last year, the flu vaccine was not matched very well with the flu that was circulating. There's so many different strains of flu, and the manufacturers have to select certain strains of flu to put in the vaccine, and they didn't match that very well last year. So you still get some protection with the flu shot, but it wasn't a good match. So what I'm understanding this year is they have a much better match, so hopefully we'll prevent more flu incidents this year.
Okay. Is there anything else you would like to add or educate us on about this flu?
One thing I failed to mention is you do need a flu shot every year. You know, with a lot of vaccines, you get one and you're good, but you do need a new flu shot every year because there's different strains of the flu in the vaccine every year. And there's also a high-dose flu vaccine, and that would be for those over 65 years of age, and that is recommended for those individuals so that they can mount a better immunity. And it takes about 2 weeks for you to get your full immunity after you've gotten the shot. So you want to plan a little ahead so that you are protected.
Okay.
Well, Carol, thanks for coming in today. After the show, I'm sure you will probably slip in my office and sharpen that needle a little bit and give me my flu shot. So we
Sounds
appreciate
good.
it.
Thank you.
Can't afford health insurance? Fayette Regional can help. The Healthy Indiana Plan, HIP, has been expanded, and now many more Hoosiers qualify. There are inexpensive plans that include medical, dental, and vision care. Fayette Regional has the resources and staff that can help you sign up. Call 765-827-8998 or visit FayetteRegional.org for more info. Fayette Regional, your community hospital. Is acute or chronic pain keeping you from everyday activities? The Fayette Regional Pain Management Center and Dr. Danielle Turnak can help. With over 20 years' experience, Dr. Turnak specializes in chronic pain management with comprehensive treatments and therapies to help individuals ease their pain. Call 765-827-7850 or ask your primary care physician for a referral. The Fayette Regional Pain Management Center.
Welcome back. Joining us now are Ruth Harrison and Ruby Shera from the Community Sharing Food Bank. Thanks for joining us today, ladies.
Thanks for having us.
Well, I'm sure you're coming up on the busy season for your group and the upcoming holidays. They're just around the corner, actually a couple weeks away. It's Thanksgiving. I hope that we can help make that the local viewers aware of the good things that you provide throughout the year. So let's just start off by each of you telling us a little bit about yourself and how you became involved in the Community Sharing Food Bank.
I'm Ruby Shera. I've been with the Community Sharing for about 8 years now. I wanted to get involved in the community some way, and I felt this was one way that I could serve the community. And I had a friend who worked there, and she had broken her arm, so I started filling in for her, and I became a permanent person.
Wonderful. Okay.
And I've been there for 13 years. My sister got me started, and once I got started, I got hooked. And I love working there very much.
It's a wonderful service and much needed service in our community for sure. So what is exactly the Community Sharing Food Bank, and tell us the address, the location, where you're located.
It's a, I forgot what I was going to say. It's a nonprofit organization, 17 volunteers. And
17 volunteers.
17 volunteers,
wow.
Yes. And we're located in the Kerrigan Lockhart Building, 2140 Indiana Avenue.
Okay. All right. So what is the food bank? What are you doing as a service? What is the program? Explain that to us.
We serve the residents of Fayette County. Anyone living in Fayette County can come in to get food, and we serve them once a month, and they are entitled to come in and they get food for the number that it is in the household, that lives in the household.
Okay. And so how long has the Community Sharing Food Bank been serving Connersville?
It's been there since 1985, and we have a couple, a husband and wife team, that have been working there helping us for 20 years.
Wow, 1985.
1985. We've been there a long time.
That's long-standing service to the community. That's wonderful. So who is eligible to receive help from the food bank?
Anyone can come, but they have to bring something with their current address, and it has to be in Fayette County.
Okay.
And when they come to get food, they have to sign a paper saying that they don't make more than what is eligible for the number of people in their household.
I see. Okay. And so when you say bring something, so you're saying like a utility bill or something that
Anything
shows
like
their
that.
address with their name on it?
If they've got a current driver's license,
Driver's license, okay.
that's eligible. But
Okay.
if they don't have a current license, then they have to bring an electric bill, something like
Something like
that.
that. Okay. And so how much food can one family receive?
It depends on the number in the household.
Okay, so it is that you go by number of
The
individuals
number
living?
of the household, yes, and they can come once a month to get the food. So
Okay, and so each family one person out of the family, how does that work? Just,
one person can come, or as many as wants to come, but one person, and the ladies in the office take their order for the food that we have, and we give the order to the men in the back who package the food, and they can come once a month to get this food. And it depends on the number that they have living in the household, how much food they are given.
okay,
And that changes too, because they'll have people move in with them. The way things are in Connersville, they have relatives that can't make it, and they move in with them. So that's how we do it.
you gauge
If they-
how much
that's how we
food
gauge
they're
how much
eligible to
they get.
receive. Okay, well, very good. So tell us about the quality and the freshness of the food that's provided at the food bank.
The food is just like you would get in the grocery store, and we have to keep it that way because we're inspected, and we have surprise inspections,
Okay.
and from the FDA and from the health department. So
And so you have pantry type food as well as frozen and refrigerated foods as
yes,
well? Okay.
yes, and we get bread and sweets from a couple of the grocery stores.
That's great.
That every time.
Okay. Well, we've talked about the people who are served. Give us a little information about the volunteers that help make that possible. You spoke to that just a little bit. Give us some information about your volunteers. You said there's 17, is that right? Okay. Tell us a little bit about your volunteer program.
Okay, we have 4. We're open 3 days a week, so we have 4 that work. Two ladies work in the office, and 2 men do the packing.
Okay.
And we have enough to do that 3 days a week, and then we have 2 or 3 that are officers that are not able to work. They have other jobs, but they did volunteer to come in and help the secretary and the treasurer, which we had trouble finding. So they came in and helped. So
And most of us are senior citizens.
yes, yes, very much so.
Okay, well, that's wonderful that you continue to give back to the community, though.
Yeah.
That's great. So are you needing more volunteers, or do you pretty much have it handled?
We need volunteers.
You need volunteers.
We have the corrections people that help us when we go to get the food we get it once a month from Gleaners.
Okay.
And these people come from corrections to help us get the food from the semi and bring it down to our facility.
Okay.
And that helps with that on Tuesday. But we do need volunteers because, as she said, we're all getting older. Very much older.
So, is during the holiday season, does it become busier where you need more volunteers during the holiday season, or is it just pretty consistent throughout the year?
It's pretty consistent throughout the year, but we do get a lot of donations during this time, so we need people to help us to bring it into the facility where we work. But we are thankful for the community that donates so much at this time of the year, too.
And so, do you have more individuals coming in during the holidays, though? Does the need seem greater, or again, is that need consistent through the holidays?
I think it's pretty consistent. We just, we're starting to get more now. We were kind of slack during the summer months, and we were kind of surprised at that. But they are starting to build back up again. We're starting to have more. So.
Okay. Is transportation an issue for individuals trying to?
Yes. Some of them don't have transportation. They'll come in there. Some of them come in with a wagon. Some of them just walk a long ways, and then some of them ride the bus. they'll come up there in the bus.
On the
and they'll
Fayette
let
County
them-
Transit? Okay, good.
Some ride bicycles.
Yeah, some on bicycles.
Oh, wow.
so.
Okay. All right. So finally, what are your hours? And so how, if someone is in need, what is the process for them? And then if hopefully through this program, you'll get some volunteers through this.
Yes.
So how would one go about volunteering, or how would they contact the food bank if they do need assistance?
I guess they would, if they wanted to volunteer, they would call probably the pantry on the days we're open.
Okay.
Or talk to somebody that they know. We've been very fortunate to find somebody that we know to help us. So all the people that work down there are either friends or relatives or something, or they go to church with them or something
Kind of
like
the way
that.
it goes. You pull your friends and family in
Right,
for your
right,
yes.
right.
Yeah.
So, and we're open Monday, Wednesday, and Friday from 1 to 3.
Okay.
So-
And so if someone was wanting to take advantage of this program, they don't necessarily have to call in advance. They can just show up.
They don't need an appointment, they just come in, yes.
Okay. All right. Well, thank you, ladies, for joining us today. Is there anything else that you'd like to add, or we've left out? Any questions?
You know, one thing we thought maybe we should let you know that they are allowed to come every 30 days. But in case you wonder how we know whether that's been 30 days or not, we in the office have a card file.
Okay.
And we keep a file on everybody that comes in. If we have a new one come in, we make a file card for them. And then on the back of that file card, we write the date that they come in. And then if they come in before the 30 days are up, then they can't get food until that 30 days are up.
Okay. Are there different ways you get supplies to stock the food bank?
Well, in October, our church was standing out in front of Kroger's, and we got 1,300 pounds of food
Wow.
in 6 hours.
Oh my, that's wonderful.
And then they decided the month of November, our church itself out at the church are taking up, and the preacher has challenged us to get 1,300 pounds for that. And then we found out the other day that Frazee is going to be taking up food for us in December, the month of December, and they're having a competition between classes.
Oh, that's
so
wonderful. That's a good idea.
that'll be really probably get us a lot of food, because when you have a competition like that, that's another way that we get food. So
That's great.
we appreciate every bit of it too. Okay.
All right. Well, very good. All right. Before you leave, we want to let the viewers know that Fayette Regional will be collecting food for the Community Sharing Food Bank the entire month of November and December, and you can bring non-perishable items to Fayette Regional location. Boxes will be clearly marked, and hopefully this will go a long ways to help and supply the food and meet the needs in Fayette County.
We appreciate it.
All right. We'll be right back.
Fayette Regional Mental Health Minute.
Depression is a treatable illness that can affect someone in mind, body, spirit, and community. Warning signs of the mind include sadness, tearfulness, irritability, and decreased concentration. Warning signs of the body include changes in sleep and appetite, fatigue, decreased energy, aches, and repeated trips to the doctor's office. Warning signs of the spirit include hopelessness, despair, and preoccupation with death or dying. Warning signs of the community are social isolation and impaired relationships. If you are concerned that you or a loved one is suffering from depression, seek help. The Fayette Regional Care Pavilion offers outpatient and inpatient behavioral health services for children, adolescents, adults, and seniors. For more information, call 765-827-8022. There is help, there is hope.
Welcome back. We have just enough time to say goodbye. We look forward to everyone joining us again next time on Fayette Regional's Health Talk. I'm Tammy Dowd.
And I'm Doug Fischesser. Stay healthy, Connorsville.